I would like to start out by introducing you. Most everyone knows you, Dr. Jon Stone, neurologist from Edinburgh, and we appreciate you being here. I'd like if you don't mind, if you'd first tell us a little bit about the upcoming conference that will be going on in September, just to give us a brief.
Sure. Yeah. Well, thanks very much for inviting me back. And yeah, so we're excited about our meeting that we've organised in Edinburgh in September. It's a 3-day international conference on FND. It's an international meeting. They're quite unusual, these meetings. The last time there was anything like this was probably about 2009, and that was really just focusing on movement disorders, whereas we're covering with this meeting the whole of functional disorders within neurology. So we've got sessions on movement disorders, seizures, memory, dizziness, speech, and we've got a whole day on thinking about mechanisms, brain imaging. We've got a whole day on treatment. So so far we've got nearly 400 people registered, which is fantastic, and so I think it will be the largest meeting. It's very much based on the structure of the book that we came out just last October, which was written for a health professional audience, but again was the first time that anyone had brought together all of these different strands of functional disorders. We published a book in a series that's been going. It's a sort of rather venerable series of books in neurology. It's been going since the late 60s. So this was volume 139. Functional neurological disorders. It's the first time they've had one on this topic, which I think tells you something about where the field's coming, and that neurology is beginning to see this as a mainstream topic which needs to be on the curriculum and deserving of attention. So I see that as a great positive.
I agree. I think that's absolutely wonderful, and I really appreciate the work that you and others have done to bring that together, because it really has progressed over the last couple of years, and I definitely see it progressing, multiplying even more, as the years progress. So I think we're definitely headed in the right direction. We've already got questions coming in, and I just want to kind of let our viewers know if they would like to ask the question themselves, then they can raise their hand. We ask that they do please turn their video off, and we'll bring them over. They'll kind of be removed out of the webinar for a minute, and then they'll pop up and they can ask their question. They also can use the Q&A below for any questions, and we'll do our best to try to get to as many people as possible. The first question that we have, she says her name is Judy, and she has a positive diagnosis of FND with a right leg weakness. She was offered the program to work in London, and she chose not to participate in the CBT program portion of it. And upon her request, then she was told that she wouldn't be able to do the rest of the program. So her question is, can I apply brain retraining to improve the function of my leg, or do I need to reconsider the collaborative program at the London Neurology Hospital?
Okay. Yeah, I'm looking at that question as well. I don't know, Judy, whether that means you were declined, whether you were declined from the whole program, or whether whether they were still offering you physiotherapy.
She was declined. I know from this instance, because we did receive an email. She was declined from the entire program because they said that it came as a whole, that she didn't feel like that CBT was right for her. Does she have any chances of getting better, theoretically, is kind of what she's asking.
So I think, so obviously for patients who've got weakness, then physiotherapy from a physiotherapist who understands FND and understands how to use retraining techniques for this particular condition can be very helpful. What I would say, and I know that physiotherapy is often more popular with patients than CBT, cognitive behavioural therapy. I know many patients don't like the idea of psychotherapy. They think, I don't need psychotherapy, I haven't got any psychological problems, I don't need, I'm not stressed, etc. I understand that, but what I would say is that CBT in the right hands can be very helpful for, including for patients who don't have um, depression or anxiety, including for patients who have not been stressed. What we're trying to do with treatment, as Judy says, is retrain the brain. The brain has gone wrong in a functional disorder. It's not functioning properly, and we're trying to get it to work normally again, and in particular promote automatic movements that usually are preserved. And you can do that with physiotherapy and movement, and that's an obvious way to do it. But you can actually approach that through CBT as well, by looking at the way that you perhaps have been thinking about movement, the way that your life and movement might change as a consequence of symptoms. So I'd encourage everyone not to sort of have a closed mind to CBT and not to view it as something that's only for people with psychological problems. CBT is useful in all kinds of conditions, multiple sclerosis, Parkinson's, and useful in FND. The answer is yes, you can get better. You can improve the function of your leg just with physiotherapy, but it really needs to be a physio who understands FND. That seems to be very important. Recent research backs that up too.
Great, thank you. That sort of leads into another question that we received as well. And basically the question was, if the person has had long-term FND and hasn't had a chance to participate in a rehabilitation type program or had really any help at all, what advice could you give them, and is there a chance they still can get better?
Absolutely. Yeah, one of the things that most of the experts agree in, there's a question we're commonly asked, can you tell who's going to respond to treatment? Is it, what if someone's had symptoms for 10 years and they're very disabled? Is it still worth trying? The answer is, in my experience and many others, is absolutely yes. It's the nature of this condition, really, that however long you have it for, there is the potential for improvement. I think it's true that the longer you have it for, perhaps the harder it is to get better. But I've had patients who've had symptoms and been in wheelchairs for 10 years or more and have improved to the point of being able to walk again, or had seizures for many, many years. So if I'm seeing somebody, I don't worry too much about how long they've had it. I just want to make sure that they've got access to treatment and access to understanding their diagnosis and therapists who understand it. So absolutely, go for it, however long you've had treatment, if you can, and hopefully find someone who understands the condition.
Great. We have a question, and I'm going to let him ask himself. Go ahead, Mo.
Yeah. So I just recently was diagnosed with FND for my tremoring right hand, which is on and off again. Right now it's pretty on, but I can stop it by splitting my hand out for a second, which is interesting. They all found that interesting. In the research that I've done, it seems like most treatments have about a 10 to 15% success rate. But I'm new to this, and I'm curious if that's accurate. And if it is, where does one start? Sorry to be so big.
I don't think that is accurate. I mean, it's difficult to give a sort of, what's the success rate. I know people would like to know that, but I mean, I can tell you, for example, that in a recent trial coming out of London, a randomized trial, where 30 patients had specific physio for FND and 30 patients had general physio for FND. At the end of, and they only had it for 5 days, but it was intensive. After 6 months, 78% of the people who'd had the specific treatment rated themselves as better or much better. 19% of the people who had the non-specific physio did the same. So it depends what treatment you're getting, and many other factors. So I wouldn't have said it's 10%. There are many other things that vary. It depends on the symptom and all those things. So, but I think it's worth trying to be a bit more optimistic than that.
Yeah.
Sorry, there was another part of your question that you said as well.
Just curious where maybe the best place to start, whether it's
Yeah.
grab everything at once or start somewhere and kind of build on that.
Well, you've got a diagnosis. I would say for anyone out there who's struggling with this, just ask yourself, you may have a diagnosis. Do you have confidence that that's correct? How confident are you on a scale of 0 to 10? I know people find it difficult to get their head around this. Being confident doesn't make the problem go away, but it's important to be reasonably confident in order to benefit from treatment, I think is the way I would put it. And then if the main problem's tremor, I would start with a physio who understands FND, and whether that's available in your area, I don't know. In some ways, what you want is to find any health professional who is interested and willing to try different treatments and be adaptable. So that might be a physio, it might be a psychologist, might be a neurologist, might be a psychiatrist. So it depends on who you have available to you.
Great, thank you. We have another question coming from Massachusetts, US. What suggestions do you have for orthotics or devices for leg functionality? Her particular knee gives out and her ankle rolls when she walks, and she's just wondering what type of devices would you suggest, if any?
Well, generally, actually, although you might think that it's obvious to have a device, orthotics, actually they're generally best avoided. Most people in the field would agree about this. In a patient who's motivated and trying to get better, then these sorts of things, what they do is they do provide some stability, and they can, in the short term, help people. But in the longer term, what they tend to do is reduce muscle strength. You've already got a limb which is not working properly, which your brain is not having trouble communicating with. Putting an orthotic on it, or a knee brace, or an ankle splint, tends to amplify that problem. It presents another obstacle to recovery. So generally, we'll try and reduce reliance on these things. Having said that, if you're in a situation where you've got chronic FND and treatment hasn't helped you, then orthotics and devices can be useful, and they can improve quality of life. It's a bit like having a wheelchair. For some people, it definitely improves their quality of life. For others, it presents an obstacle to recovery.
Great, thank you. We have another panelist, but perhaps maybe what we'll do first is take another question that someone has asked. How important is it to identify the trigger for FND in terms of promoting recovery and avoiding relapses?
Yeah, I think not as important as many people think, I would say about that. So a lot of people think, well, if only I knew the cause of it, then I would be able to sort it out. Well, medicine doesn't really work like that. We don't know why many things happen, like Parkinson's and MS and migraine. Some people can identify triggers, and it can be helpful. So they notice, for example, that migraine triggers their FND or stress or fatigue. But generally, it's more important, I think, to learn to know what to do with the symptom when it arises, because typically FND symptoms are they come and go, and they're often quite random. They occur out of the blue most commonly. So it's more useful to know what to do when you have them, and how to respond. When you wake up in the morning, your arm doesn't work, or your foot twists in, or you have a seizure. So I think you've got to keep an open mind about triggers, but not. Some people tend to have that as a big focus, either patients or therapists. Actually, sometimes therapists and doctors are guilty of focusing too much on that, I think.
Great, thank you. We have a question now. Leslie, if you'd like to go ahead. Leslie, you're on.
Hi,
Hello?
Leslie. Hi there.
Hi, can you hear me?
I can, yeah.
Yes, we can.
All right. I have quite a list of problems. I've got fibromyalgia that I've had for about 20 odd years, diagnosed. Diabetes, osteoarthritis, a skin condition, depression, and various other things. Just over 12 months ago, I was taken into hospital in a state of seizure. I was in hospital for 5 weeks in seizure for most of that time, waiting for a bed at the neurology hospital. I was in Inverclyde, near Glasgow, well, Greenock. I was eventually sent home because they couldn't get me a bed in neurology, but I got diagnosed, I think it was about August last year, with FND, and told that it was non-epileptic seizures. At the moment, I'm on a waiting list for CBT therapy, but I have no idea how long that's going to be. I'm on anti-epileptic tablets all the time, plus other things. If I don't take them, or if I'm tired, my tongue is constantly clamped to the right, although it's my left-hand side that is more affected.
Okay. Leslie, do you want to just in the interest of time, just come to the question?
Well, one of my main things I would like to know is, I don't feel as though it's getting any better, the FND, and I want to know whether it's something that is a progressive thing if you don't get treatment.
Well, the trouble with the answer to that question is, in some people can be progressive and does get worse and gets worse despite treatment. In other people, they have FND symptoms for a week. Other people, it stays the same. And so I know that's a frustrating answer because you want to know what's going to happen to me. But all of the studies tell us that the outcome varies hugely from person to person. And it's quite difficult even to predict who's going to get worse and who's going to improve. Access to treatment is important. Access to a patient who's confident about what's wrong is important, as I mentioned earlier. I know it's very frustrating waiting for treatment.
Thank you. We're going to take another question here from one of our attendees. Anonymous, has there been any research done to see if perhaps there's a link to FND and a bacterial or type of infection which could possibly be causing brain inflammation that may be contributing to a wide range of neurological symptoms?
Okay. I've got some people saying there's no sound. Dr. Hager is telling me there's no sound. Can other people hear me? Can anyone else hear me? Someone else has sound.
Others said they have sound, so.
Okay, that's fine. Okay, I'm sorry you can't hear me, Doc. So, yeah, is there a link to bacterial spirochetal infection causing brain inflammation? Well, I would say that in the routine course of investigating many patients with FND, they'll have investigations to look for infection. It's important to say here that the diagnosed FND is not one you make just because the tests are normal. So that's how many doctors have erroneously thought of it in the past, that you have a patient with lots of symptoms, you do some tests, they're normal, have they got FND? That's not how you diagnose it. You have to have positive features of the diagnosis, so Hoover's sign for leg weakness, entrainment test for tremor, typical features of a dissociative seizure. So it's possible to make this diagnosis even in patients where you know they have a bacterial infection, where you know they've got Lyme disease. You can still make a diagnosis of FND. There is a very complex area here to do with some patients in particular believing that perhaps they do have chronic Lyme disease, for example, and that is leading to their symptoms. it's a contentious area and one we haven't really got time to cover today. But there's been a lot of thoughts gone into that, and I think the answer is that there isn't evidence for that, and particularly in the way that patients will respond to specific therapy for FMD would also support the idea that their symptoms are not a latent bacterial infection. But it's not really about that. It's about the positive features of the diagnosis that can't be explained by an infection.
Great, thank you. We're going to have a question. We do ask, if you are asking a question, make sure your TV and background noise is down if you can. Alex, do you want to go ahead?
Hi, sorry, yes, can you hear me?
Yes, we can.
Right. Hello, sorry, I'm just about to walk out of the room where the television was on, sorry. I was recently told that I've got FND after seeing a neurologist because I've got various different neurological symptoms. Main problem being double vision and balance problems and paresthesia. She really just sort of said to me, well, they're functional problems and they are, go away and deal with it. My problem is, how do I help myself with balance issues and double vision and swallowing problems that I experience?
Yeah, well, it's not helpful, is it? Is the neurologist going to see you again, or is this a one-off meeting?
They've done an MRI of my brain just to double check really that there is an MS.
Are they going to see you again though, the neurologist?
They are, yes, in about 3-4 months' time. But I was left really with no explanation other than have a look at your website. Was the only answer I had.
I'm aware that many patients are in that situation where things are not necessarily explained to them. Sometimes that's because there's just a time problem, but and looking at a website isn't enough. I know that.
No, it's very confusing, to be honest.
Confusing. So, and also you're in a position of slight diagnostic limbo, aren't you? If they're saying to you you've got FND, but they're also going to do an MRI, you don't know the result. I think that puts people in a bit of a double bind there, because they're being, on the one hand, they're being told that this is a diagnosis, but they're also, the doctor's doing a scan. Is that because they think they're going to find another cause? It's quite hard to embark on treatment in that situation. This is what I was coming back to, this idea of feeling. It's important to feel settled and confident that you know what the diagnosis is and your health professionals believe you and support you. It's bad enough having this without those things being uncertain. Double
Absolutely.
vision in FND, if it is FND, is usually caused by something called convergent. Convergent spasm. That's where there's a movement of the eye that's overactive, and it's not easy to treat. But sometimes orthoptists who work with ophthalmologists can help.
Right. Okay.
Balance problems are probably best approached with physiotherapy. But again, I would caution anyone about attempting treatment if they're in a situation where they're just feeling like they really don't know what the diagnosis is, and then really a bit skeptical, perhaps, about the diagnosis of FND. It's unlikely to be successful in that situation, because you'll be, the sort of things that you need to do to improve, to challenge the kind of bad habits your brain's got into, if you like, in FND, are very difficult to do if you're not sure what's going on. So I hope that you can get some more clarity and answers from your team. It's worth asking, seeing from the doctor how confident they are, how they made the diagnosis, get them to explain why they're making this diagnosis, what are the positive signs that indicate this to them.
Okay, great. We have another question that we'd like to ask is, what would you suggest when your neurologist doesn't know what to do, and after you've seen a few of them?
Yeah, well, I mean, I'm faced with situations where I don't know what to do. I mean, we don't have all the answers, and that's not just FND. That's lots of conditions I see. You know, brain's complicated; it goes wrong in complicated ways, and many of us we're just doing what we can. I think it depends how much you want to make sure. If the neurologist says, "I don't know what to do," that might be if I say I don't know what to do, that's hopefully I've made quite a bit of effort in thinking about what could be done, exploring every avenue. If a neurologist saying that, I would hope that they would have made a similar effort. You might say to them, do you have a colleague who's got a particular interest in my condition? Would it be helpful to see them? What about these treatments, physiotherapy, psychotherapy? Would they help me? So it's a difficult one, but I appreciate it's a situation that does arise where everyone's
Right.
done what they can.
And it is difficult, and I think it does show when we have such an interest in this upcoming conference that there are doctors out there that do have an interest, and hopefully there will be more help coming and to more patients around the world. We're running out of, well, we've ran out of time, but we'd like to ask just one more question to kind of end on is, do you have any tips on how to gauge like how much fun someone should have? In this particular question, my daughter will have a lovely day with minor symptoms sometimes, and the next day she'll suffer with awful symptoms because she kind of overdid that. Do you have any tips that you can recommend?
Yeah, so that's very common that people find that their symptoms vary a lot from day to day. In fact, it's a bit of a hallmark of a functional disorder generally, that symptoms at some moments seem not too bad and others they're dreadful. And that's also telling you something about the disorder, and that it is a problem with nervous system functioning, which can improve and get worse day by day, compared to if it was due to brain diseases, where symptoms do vary, of course, but usually not as dramatically as patients with functional disorders. The thing to do there, it is a good idea to try and recognize if you are in that so-called boom and bust cycle of activity. Very common. It's very tempting when you have a good day to think, oh, I'll go and do all the things that I wasn't able to do yesterday. I'll do that bit of housework and I'll catch up with that. And to really sort of feel, oh, cool, maybe this is it. Maybe I'm going to feel better now. And then sort of crashing later that day or the next day, and then feeling really miserable because actually you're not better. You're back to square one. So the advice there is to really just try and remember that you do have a condition, that yes, it's okay to go and do some things, but just try and pull back a bit from what the things you would like to do. Recognize that if you do that, you'll be perhaps making things better for the next day.
Great. I think that's excellent advice. And I think it's also important for those around you to remember that just because that day you are well, that you do need to still pace yourself. And
Yeah.
And I think sometimes they take on pressure that they need to do more and participate in things that are really that they even know for themselves is too much. So I think giving yourself that permission to pace yourself, that it really is what the doctor orders instead of the specialist, Dr. Stone.
Yeah. So just to add, on a day-to-day basis, I think that's right. But I think you need to take a long-term view as well. If you're attempting to get better, then doing that is okay. But you do need to then be pushing yourself over the weeks and months to gradually increase your activity. And this is the thing I know people find very hard. But energy in the body is more like a dynamo than it is a battery. The day-to-day, it feels like a battery. A very uneven one. But over months, it's more like a dynamo. The more you are able to do on a regular basis, the more energy you will have, usually.
Great. Thank you. We appreciate your time so much. And a lot of the chats and viewers are definitely saying thank you. I just want to pass that along to you. And we appreciate the time. And I'm sorry we can't get to everyone's questions. Dr. Stone will be doing these I wouldn't say maybe monthly, but we are going to do them periodically as he has time. So please keep an eye on the website. This will also be available. If you didn't hear a question, check out the Facebook page and we definitely can get there. And thank you so much. We appreciate having you.
Great. Well, that's very kind to invite me. Thanks, everyone, and look forward to speaking to everyone again. Thank you.